Most people know that dermatologists treat diseases of the skin, but some people don't realize that dermatologists also treat diseases of the hair, scalp, and nails. So, dermatologists make diagnoses and treatment plans for people with alopecia. Alopecia is just another word for hair loss. And I think it's important for people to realize that alopecia is not just one diagnosis. There are many different types of alopecia, and that's why it's important to have a dermatologist diagnose what kind of alopecia you have. As many of you know, the hair and hairstyling is such an integral part of our sense of self, particularly for Black women. We express ourselves through our hairstyles. We change our hairstyles frequently. It really is part of our identity. So when people start to suffer from hair loss, it can really be more than just hair loss. It can really be a hit to our sense of self. And this is why treating alopecia is so important and so rewarding for me as a physician. There's a wide range of hair types that we find among Black people, from straight hair to the curliest hair, from 1A to 4C. But on average, most of us have hair that is curly. Black hair tends not to be very round when you look at the diameter. It tends to be more of a flattened ellipse. And along the length of the hair shaft, the diameter of the curl can change at different points along the hair, and there are twists and kinks along the length of each individual hair shaft. Most people have approximately 100,000 hair follicles on their scalp, so to have 100,000 hair follicles producing hairs that have different curl diameters at different points along the hair shaft and along different points at the scalp, and that twist and turn and kink give us our own unique set of hairstyles and hairstyling challenges. I often educate other physicians that our unique hairstyling practices and our unique hair care practices really all stem from our unique hair texture. So I remind physicians that it is very common for people with curly hair to maybe shampoo once a week or even once every 2 weeks, and sometimes less if you're wearing a braided hairstyle. I often remind patients that I love braided hairstyles, but they can't be too tight, right? Because that can lead to hair loss. So braids, knotless braids are my favorite. Twists, locks are all wonderful styling options, particularly for those of us with highly textured hair. Conditioning is super important because our hair can be very porous. So we not only deep condition at shampoo time, we use leave-ins and then often need to add additional conditioning agents in between shampoos, especially if that's only happening every 1 or 2 weeks or more. It's important to remember that there are many different reasons why people lose hair. Now, often the dermatologist is not your first stop when you're experiencing some hair loss. There are some things that you can try at home. For instance, over-the-counter products containing minoxidil can sometimes encourage hair growth. People often like natural treatments. For instance, rosemary oil has been shown to help hair grow. People also will sometimes try supplements, many of which have no scientific evidence behind them, but some of them do. What I remind people is if after 4 to 6 months, you're not seeing improvement in your hair loss, it is time to make an appointment with a dermatologist. Sometimes we're losing hair not just because of a stressful period, not just because a one-off hairstyle didn't work out for us. Sometimes we have an underlying scalp disease, and early diagnosis and early treatment are key to preserving as much hair as we can, and really key in trying to bring some hair back. There are many aspects of an evaluation for a patient who's experiencing hair loss. So we look at a patient all over their scalp and often at their body hair with the naked eye. We will sometimes use a dermatoscope, which is just, a fancy magnifying glass. We'll sometimes do a scalp biopsy so that we can see what's going on with the follicles below the surface, and we'll sometimes check blood work. And what blood work we check will depend on what form of hair loss we're evaluating you for, but we will often check not only vitamins and minerals like your vitamin D level or your iron or ferritin levels, but we'll sometimes also screen for other internal conditions like thyroid disease that can contribute to hair loss.